49. CT brain shows parenchymal fat and calcification diagnosis. Tumors. CT brain shows parenchymal fat and calcification diagnosis. Tumors. 50. Esophageal duplication cyst is seen in posterior mediastinum or middle mediastinum most likely. See. Esophageal duplication cyst is seen in posterior mediastinum. In some books it says middle mediastinum and some books it says posterior mediastinum, but here it says posterior mediastinum. Esophageal duplication cyst is seen in posterior mediastinum. 51. Ultrasound finding of interception, a target sign. 52. Finding flowing occupied from T8 to T11 on right side due to dish. Flowing occupied from T8 to T11 on right side due to dish. 53. Multiple expansile lesions with ring and arc calcification in hands, Warrior disease. So, multiple expansile lesions in ring arc calcification seen in Maffucci syndrome, B. Maffucci syndrome. With ring and arc calcification in hands seen in Maffucci syndrome, without ring and without calcification, then it is Warrior disease. MCPS, MCQs FCPS 2 July 2017. Number 1. 56-year-old female. Treated for carcinoma neck 18 months back, now presented with colic abdominal pain. CT shows thickening of ileal wall, dominant narrowing, cause of partial obstruction, increased adrenal maternity, likely cause is irradiant enteritis. 2. Pancreatic calcification found in cystic fibrosis. 3. Tumor found in diabetic ketoacidosis. 3. All repaired. 4. Morphological type of calcification malignant solid pyramid nodule is C. Concentric. Question number 5. CT feature indicator of extension of carcinoma cervix is parametrial stranding of structures. Question 66. A 60-year-old patient with history of hepatitis having multiple hepatocytic nodule ultrasound. Diagnosis is regenerative nodule post-cirrhotic liver. Having hepatitis, multiple nodules, hyperacute nodule ultrasound. Diagnosis regenerative nodule post-cirrhotic liver. 61. Most common findings seen in chronic asthma on X-ray chest is normal. First is normal. If there is not an option, then diagnosis B. Hyperinflated lung flares. Most common findings seen in chronic asthma on X-ray is normal. If there is not an option, then B. Hyperinflated lung flares. 42. Most characteristic finding on tuberous sclerosis on CT is calcified subabdominal nodules. 33. Characteristic finding seen in NF1 is plagiform neoparbromas. 3. 64. Old male patient with bronchogenic carcinoma presents with lung collapse due to obstruction of right main bronchus. Most likely type of electrolysis in this patient is B. resorptive. 65. Most common site of meningioma is cerebral convexities. 657. Again, CT is dose of fourth generation is free of ring artifacts, and the dose of third generation CT is higher than fourth generation. Is wrong. But the answer is the fourth generation is free of ring artifacts. Dose is higher in fourth one, but fourth generation is free of ring artifacts. 58. The patient has X-ray chest with shift of mediastinum towards right and left hemidiaphragm elevated. Diagnosis eventration. It cannot be diaphragmatic hernia because there is no bowel loop mentioned in the MCQ. So just X-ray with shift of mediastinum towards right and left hemidiaphragm elevated. Diagnosis eventration. 59. Pattern of pyruvate reaction indicating benign pathology is soap bubble is none of the above. If there is soap bubble appearance, then it will be benign. Otherwise, E. None of the above. Correct? Not these are all malignant bone reactions. 60 on mammogram. A well-defined density is seen in medial quadrant on MLO view. In ML view, it will lie in superior. On well-defined density in medial quadrant on MLO view, on ML view, it will lie in superior. See. 53. Best view to see small apical pneumothorax is PA with full expiration. Best view to see small apical pneumothorax is PA with full expiration. Now, another is lateral decubitus position. If this is not an option, PA with full expiration, then just is lateral decubitus position with affected side up. 54. View to differentiate true structure of colon from preserved obstruction is shoot through view. Lateral shoot through view. Plain abdominal radiographs are used as a screening tool for bowel obstruction, but do not exclude this if they are normal. The main findings include dilated bowel loop with or without the presence of free fluids. The right chest radiograph can also be used to screen for complications for patients. 55. Millitesla plus ms per second used in MRI indicates gain equals flow rate. A. 56. Main advantage of CT or MRI diagnosis of a hairline fracture of temporal bone is best demonstrated on CT. Hairline fracture of temporal bone is best demonstrated on CT. 649. Female patient with acute renal colic and hematuria, adequate investigation that should be performed in emergency is CT palliography. Patient with acute renal colic and hematuria, adequate investigation that should be performed in emergency is CT palliography. 50. A patient has a history of severe abdominal pain during anemia. He has stricture of sigmoid colon with drug is given and study is continued. I have seen. Patient has abdominal pain during anemia and has stricture of sigmoid colon with drug is given. I have seen. 51. AVN of drained bone scenarios, clean box disease. AVN of drained bone scenarios, clean box disease. 52. Best view to see pneumoperitoneum is chest X-ray erect. Best view to see pneumoperitoneum is chest X-ray erect. Now, submarinal duct stone is seen in oblique view, and submarinal gland is seen in AP view. 45. Radioisotope used in dynamic infrared is DMSA scan. Radioisotope used in dynamic infrared is technique 99M. Radioisotope used in dynamic infrared is technique 99M. 46. Inotropic agent used in cardiac sonography is adenosine. Inotropic agent used in cardiac sonography is adenosine. 47. Barium soil examiner of patient with unilateral brachial palsy claim was obtained in APUA. 48. Unilateral brachial palsy phenomenon obtained in X-rays APU is the answer. 48. Best way to see dilated central loop of duodenum and pancreatitis is E is greater than C. Frontal abdomen. Best way to see dilated central loop of duodenum and pancreatitis is frontal abdomen or plain abdomen. If there is not an option, then lateral leucobrus view. 49. 40. 40. A patient after hours on consciousness at home was taken to hospital. On examination, she has negativity. First investigation that to be carried out is a CT scan. Patient negativity. First investigation to be carried out is CT scan. 41. A young female had an episode of chest infection. On follow-up, she was symptomless. Her X-ray showed cystic area and right heart border diagnosis, pericardal cyst. 42. Highest rate of modern transparent frequency is used in the conversion radiograph without screen. 43. Regarding film processing, pH is 4 to 5. 44. Regarding intensifying screen and input phosphor is done by cesium iodide. Now, MCPS, MCQs of CPS, year unknown. A 10 is extended equivalent to 10 mgy radiant. Point true about this. They are not in diagnostic range. Now, 10 MSV shows no predilection. And given in fluoroscopy in 1 minute is 1 minute. So 10 mgy is not in diagnostic range. For 2, in chest X-ray exposure of 140 mgy, maximum contrast is produced by first is bramstolone 1. But if there is not an option, then because in tissue there is bramstolone, but if there is no option, then Compton effect. So 3, at 100 kV, main type of connection reaction would be Compton scattering. 4. Shift of heat load curve to left means safe. 5. Ripple produced by 3 6 pulse high voltage generator is P13%. 6. Commonest combination used in membrane perfusion scanning is BMMA with titanium membrane MCAS. 7. Transformer to main X-ray tube current is near a auto transformer. 8. A female patient with hypertension, lung and syndactyly has Poland syndrome. 9. Major changes in scleroderma and lung is B. honeycombing. And scleroderma, early changes is ground glass appearance, And layer change is honeycomb. Sweet honey at the end of meal. Is eaten at the end of meal. So layer change is honeycombing, and early change to dermal ground glass. The next one, question number 10. Patient is having distant colon loss of aspiration. He has ischemic colitis. Descending colon with loss of concentration. He has ischemic colitis. Is proximal descending colon involved, and it shows hyperenhancement. Acute colitis is greater than ischemic colitis. So loss of descending colon with loss of aspiration. Ischemic colitis. 11. Impression on posterior surface esophagus on primary swelling caused by epididymitis of purine artery. Writing from artery is the most dilated distal branch. Question 12. Double bubble sign seen in during atresia. 13. Most sensitive modality for stroke is DWIC. 14. Female patient with trapezius bladder or recurrent VURs and dimple on skin and back has diastematomyelia. Question 15. Common metastases to brain are from A. Lung. 47% from lung, common metastasis to brain, and breast cancer metastasis to bone. Question 16. Female patient of 27 years is anxious as a mother and sister died of background breast. What will be the remaining modality of choice for screening? Reference diagnosis is MRIC. MRI. Now, when do we do MRI in breast? Is either in above 40-year-old patients, positive family history, which she has positive family history of breast cancer, and in breast implant patients, we do MRI. So she has positive family history, so we do MRI. Question 17. An X-ray to look for central during loop is E. Frontal abdomen. Frontal abdomen first, as a non-option, then right lateral recursus position. This number left lateral recursus, sorry. This is non-option, then we do left lateral recursus position. So 18. Most accurate examination for tumor peritoneum is A. Chest X-ray erect. Question 19. Differentiation of intestinal obstruction from pyloric is made on both recursus position. Sorry, C. Erect abdominal X-ray. Differentiation of intestinal obstruction from pyloric is made on C. Erect abdominal X-ray. Question number 15. Nephroblastoma shows lung metastasis. Again. Nephroblastoma shows lung metastasis. Neuroblastoma shows bone metastasis. Lung cancer shows brain metastasis, and breast cancer shows bone metastasis. So neuroblastoma and breast cancer show bone metastasis. Lung cancer shows brain metastasis, and nephroblastoma shows lung metastasis. Question 20. Commonest cause of renal aneurysm is fibromatosis dysplasia. Question 21. CT of parotid duct. Sections are taken parallel to heart palate. Now, scalography is parallel to body mandible. And CT parotid duct is parallel to heart palate. 22. A bleed seen septum pellucidum and frontal lobe is due to abrupt trough anterior communicating artery A. 23. Regarding female genital tract, following is true. Three zones of endometrium can be three zones of endometrium can be seen distinctly on MRI. 24. Patient is having dysphagia and diarrhea of lower endosylvatic multiple reflux. Diagnosis is systemic sclerosis. 25. Signal intensity in acute hemorrhage is high on T1 and low on T2. Acute hemorrhage is high on T1 and low on T2. 26. Pancreas sonography shows duct diameter is less than 3 mm in adults and normal. Acute hemorrhage is IDI, so high on T1 and low on T2.